Hello, everyone, and welcome to Module 6. Module 6 is all about the nephrology unit. So this week we are again focusing on two chapters, which are Chapter 2, page 29, and Chapter 31. So let's go ahead and jump in and talk about those two chapters. So Chapter 2 is giving you a little bit of a history of the medical practices that are available. Knowing that there are different medical practices out there and having a good breakdown of those specialties is what Chapter 2 is kind of all about. It is important to know that most of the specialties do allow and have medical assistants working in their offices, as most job opportunities for medical assistants are in the outpatient setting, but that is always rapidly changing, and we could see a shift where medical assistants may one day work in inpatient settings. Medical assistants will work in inpatient settings, and this includes the topic of nephrology and working in nephrologic units. So it's good to know that a nephrologist is a provider that specializes in the kidney and disorders of the kidney. Nephrologists are skilled in both medical and surgical treatments of the kidneys, including that of dialysis. Now, because the kidneys are part of the urinary system, we're kind of going to talk about both nephrology and the urinary system. So hopefully you can keep up with it. It's not that hard, I promise. So that was Chapter 2. Let's kind of jump in now to Chapter 31. So this chapter is focusing on the urinary system that does, again, like I said, deal with nephrology. The organs that are found within the urinary system that are also part of the nephrology system are that of the kidneys, ureter, bladder, and urethra. So let's go ahead and take a look at each one of those and get a better understanding of each of them individually. And we're going to start with the kidney. So the kidney are two bean-shaped organs located in the back of the abdominal cavity. The easiest way to find these is if you put your hands on your hips and the most of your hand is in the back, what you're actually touching is right above where your kidneys would be. The kidney has both external and internal parts. The external structure of a kidney is called the hilum. This connects to the opening of the ureter, which connects then to the renal pelvis, which collects urine. The internal structures of the kidney are separated by two parts, either the renal cortex or the renal medulla. The renal cortex is the soft, dense outer layer of the kidney. The renal medulla is found deep within the kidney and forms what we call the renal pyramids. When we talk about the kidney, another key part of the kidney is called a nephron. The nephron is the functional unit of the kidney, and there are over 1 million nephrons in each kidney. So think about that for a minute. You're carrying around 2 million nephrons in your kidneys and you don't even know it. But if those shut down, those nephrons no longer exist, your kidneys will no longer function, and we all know what happens when kidney function happens. Bad stuff. Next we have our ureters. These are two muscular tubes that carry newly formed urine from each kidney down to the bladder. Each ureter is about 8 to 12 inches long and has 3 layers, the inner layer, outer layer, and middle layer. And every about 10 to 15 seconds, we don't know it, but a small amount of urine will travel from the kidney through the ureter to the bladder. This happens through a muscular contractions and relaxations that we are not functioning. That's part of that peripheral nervous system, or that involuntary nervous system that we have, if you remember that from last week. Next we have our bladder, and our bladder is a hollow muscular sac that is the reservoir for urine. So essentially it's a big urine holding tank. It's found in our pelvic cavity, and when we talk about, the bladder, we need to know that it's holding urine. And urine consists of 95% water and 5% solid substances. The bladder can hold up to 500 milliliters of urine, but you will feel that need to void when it's filled about 300 to 350 milliliters full. On average, the adult human should be voiding about 1,000 to 1,500 milliliters of urine a day. If they're not doing this, that means that there's probably something wrong with their kidneys, and we'll have to do some testing on that. Normal urine should be clear and have a straw-like color to it. And when we're talking about the formation of urine starting kind of in your kidneys, we have to know that urine has 3 different parts in it. It has the filtration, reabsorption, and secretion. And all of this happens before it reaches that bladder. Okay? And the last part is your urethra. Now, this is a tube of muscle and membrane that is responsible for actually voiding the urine out of the bladder and out of the body. It extends from the bladder to the urinary meatus, which is the opening of the urinary system. Now, this is where it gets kind of tricky and kind of confusing for people. Male and female bodies do not have the same length of a ureter. Males are about 7 inches long, or 20 centimeters, and women's are only about 1.2 inches long. The opening from our bladder as women to the urinary meatus is much shorter than it is for a male because they have extra external parts that have to carry the urine through. All right, and the last item I kind of want to discuss in this chapter are some of the common diseases and disorders that you may encounter while working in nephrology. Things like kidney stones, polycystic kidney disease, UTIs, which are very common, are urinary tract infections. Those are, bacteria or viruses and infections caused typically by E. coli. Patients can have incontinence, which is the involuntary or unpredictable flow of urine. Pretty much what that means is that they are not able to hold the urine in their bladder anymore. This is very common for women after they have children to have a little bit of incontinence. They can have things such as cystitis, which is an inflammation of the bladder, and it's normally caused by repetitive UTIs. A major one that you will see is called renal failure. This is a condition where the kidneys cease to function properly. And renal failure is actually qualified into 2 categories. It's either chronic or acute. Acute renal failure occurs when there is a change in the filtering function of the kidneys. It impairs the kidney's ability to be able to maintain normal body functions. Now, if a patient does have acute renal failure, there are no immediate signs and symptoms, but over time, urine output is decreased. They have an irregular heartbeat. They develop swelling in the abdomen and in their extremities. And the only way to treat acute renal failure is to have the patients go on dialysis. Chronic renal failure, unfortunately, is a progressive loss of the kidney function. And the only treatment is really hemodialysis or dialysis in and of itself. All right, guys, this is where I'm going to stop my video for the week. As always, please make sure that you're reading your chapters fully to help you guide yourself during a discussion post and your online quizzes. Also, it will help you prepare yourself for the lab class that you have this week. Your discussion post this week is talking about what destroys your kidneys. So you're going to have to do some outside research to find what does destroy your kidneys. Could it be medications? And if so, what are those medications? Could it be chemicals? What about genetics or hereditary disorders? Once you discuss what can destroy your kidney, you need to discuss whether there is something that we can do to better protect our kidneys and ourselves. Please remember that your initial discussion post is due Tuesday, November 8th by midnight, and you need to have 1 reply post to your classmates completed Saturday by midnight, and that's November 12th. This week you also have another quiz based off of Chapter 2 and 31. Again, 10 questions with a 10-minute time limit, and they are multiple choice true and true-false questions. Please make sure that is completed Sunday by midnight, which is November 13th. Have a wonderful week 6, guys, and I will see you and talk to you later. Have a great day, guys. Bye-bye.